Hi, I'm Cindy Perlin from the Alternative Pain Treatment Directory, and I'm here with Dr. Zilliox to talk about innovative treatments for neuropathy. So, Dr. Zilliox is a chiropractor and a nutritionist, and he does loads of other stuff that we're going to talk about. Um, Dr. Zilliox, it's unusual to be a chiropractor and get into treating neuropathy. Can you talk a little bit about how you came to be treating neuropathy?
Well, I came to be treating neuropathy because of my own experience, probably about 20 years ago when I first started in my feet. And so I was at a seminar and they were talking about treating neuropathy with a specific type of therapy equipment. And I said, I got to get on top of this. My mother was a diabetic. My father was a diabetic. I lost two aunts and an uncle to diabetes. I'm not a diabetic even to this day. I know what my neuropathy is caused from. So I started utilizing this therapy. I bought the therapy machine. I said, you know what? It works on me. It's going to work on patients. And that's how I started going forward. And there are a few other doctors in my area, maybe one or two that treat neuropathy, but not the way I do though.
And when you say other doctors, are they MDs or are they?
No, chiropractors, just
Oh, okay.
chiropractors. Oh
But
yeah.
they don't go as far innovatively as you do.
No, not at all. Not at all.
And you're in the Buffalo, New York area.
Yes, yes. I'm
So,
in Amherst. Yeah, I'm in Amherst, New York, which is a suburb of Buffalo.
but you do treat people from all over.
Oh, yes, absolutely.
People come from far away because your services are so unique and so comprehensive. So, talk about some of the treatments that you use for neuropathy.
Okay, so we have a number of treatments that we use, but I will expand on a couple of them. One of them is called uh, Synexus, and Synexus is a high frequency unit. It comes from Germany. It's listed on my website, and it uses very specific programming. In order to rehabilitate nerves, you need high frequency. And so the patients are put on a 24 visit program, 2 visits a week, and every program is different. And so the unit is hooked up to their legs and their feet, and so it's a about a half-hour treatment. And then we also use shockwave therapy. Shockwave is used for on their feet, and shockwave, which produces sound waves, and shockwaves is not ultrasound. It's very effective, especially when treating arthritis, because I have a knee arthritis program. But shockwave has been shown to increase stem cells by 400%. It has been shown to increase neovascularization, which means new blood vessel growth. It breaks up fibrous tissue. And overall, it's extremely effective. Podiatrists use shockwave mainly for plantar fasciitis. It's now used by urologists for treating erectile dysfunction, which of course is out of my scope of practice. And then you have the orthopedics who are using shockwave now in professional sports. Now,
Yeah,
pardon me.
shockwave sounds like it could be painful.
Well, it depends on depends on what you're treating. I always tell patients on a 0 to 10 scale, don't let it get above a 27. No, I'm just kidding. Don't let it get above a 6 or a 7. So they can tolerate it, and it's fine. Yep. I have two different shockwave units that we use. One goes deeper than the other. So those are two therapies that we use for uh, neuropathy, but we also use another therapy called neurogenics. And the company claims like a 90%, 97% success rate. It's another high frequency unit. This unit goes a higher frequency than the Synexus. And this therapy is used a lot by podiatrists. In fact, it's promoted a lot by podiatrists if you go on this neurogenics website. But it's another therapy we use. The other therapy, and it's high frequency, we use another high frequency unit called a neuromed. Now, neuromed also produces what's called electroanalgesia, which is like an electronic nerve block. So when people are hooked up to the neuromed, we also use it for back pain, uh, knee pain, shoulder pain, any type of extremity pain. It really knocks the pain out for a few hours, but its main focus is to increase tissue repair. So none of the therapies that I use for neuropathy or any other condition are meant to be band-aid therapies. I've invested quite a bit into these therapies. So I want to make sure that the patients are seeing benefit out of this. So it's most important to use high frequency when treating the neuropathy.
Why is that?
Because first of all, that are what are called uh, Meissner corpuscles and Pacini corpuscles, like when you're treating the feet, and you'll see these vibration machines that people use at the gym or vibration plates. Well, what we use a high vibration plate with the patient. In fact, and I'll talk about this in a little bit. It's part of their take home care package that we give them. When you say, for example, you get like a Medi foot rub or some of these cheap vibration plates, you go to Walmart, spend a couple $100 and put your feet on and it just shakes them. All you're doing is you're affecting what are called the Meissner corpuscles, and those affect the muscles. So you're really just shaking the muscles. In order to affect nerves, you need to affect the Pacini corpuscles, which affects your vibration. So, like when the doctor tests you for neuropathy, or they take a tuning fork and they put that tuning fork on your ankle, and you should feel that vibration. If you're not feeling the vibration, then your Pacini corpuscles are damaged. And this is very important with regards to balance. So, it's very important that you address the nerves with high frequency therapy.
Hmm. So that normalizes these cells you're talking about, these neurons.
Yes, it helps with uh, uh, cellular repair and nerve repair because nerves can regenerate. It's like when doctors reattach a limb, the nerves have to regenerate, and if they
Hmm.
didn't, it's useless reattaching a limb.
Yeah. I've heard that nerves just they take longer to regenerate than some other kinds of tissue. Is that true?
Yes, yes, it takes a while for nerves to regenerate. Now,
The
with
ther
regards, go ahead.
the therapies that you use, they speed that process up.
Yes, that's the whole focus is for nerve healing. Like for example, with diabetics take 4 times longer to heal than a normal person without diabetes. And what happens with these nerves are heavily damaged from diabetes. Now, there are a number of causes of neuropathy. Number one, being diabetes is probably responsible for 30 to 50% of all peripheral neuropathy. Then you have statin drugs, which can cause neuropathy. You have autoimmune diseases. You have failed back surgery that can cause neuropathy. You can have a back problem, a herniated disc that can cause neuropathy. So there are just a number it causes of neuropathy. And for example, it can be idiopathic, unknown cause. And if the doctor tells you, well, nobody knows what causes neuropathy, is not true. That's a myth. And the same thing about medications. Medications will not cure neuropathy. And what they do is the doctor will usually use Lyrica, Cymbalta, Neurontin, gabapentin, and all these drugs do is deaden the nerves. So they really don't fix
Temporarily,
anything.
that temporarily deaden the nerves with terrible side effects. I thought when you said Neurontin that you said Neurontin, and I think
No.
it's a better name for it.
Oh, yeah, right.
It's a rotten kind of therapy for neuropathy or anything else. And it's one of it's also known as gabapentin. It's the fifth most prescribed drug last year in the United States, but has terrible side effects. And like you said, it doesn't fix anything. Some people, a very small percentage, get some temporary relief along with lots of side effects. So the kinds of therapies you're talking about are, much more worthwhile because they actually get to the root of the problem.
Of course, and the latest research on gabapentin is that it's causing early onset dementia.
Yeah, I mean, people will notice that they have brain fog when they use it, and that's why a lot of people can't tolerate it. But the most recent research does say it causes dementia. And even, I think you can correct me if I'm wrong, but the strongest negative effects are in people who don't already have signs of dementia.
Right, right. And the
Younger
other thing,
people.
yeah, and the other thing is with regards to these drugs, they're used as an off-label drug. They're initially designed for treating seizures.
Yeah. Yeah, they weren't approved for all these pain conditions that they're being used for.
Hmm.
So also you haven't mentioned CalMare. I know that you do CalMare.
Oh,
Few
yes, we do
people are
CalMare.
familiar with that.
Yeah, CalMare is another type of therapy that we use. And in fact, we had a patient come in to us just recently for CalMare therapy. And they had come in and their daughter had a number of CalMare treatments down in Florida, and then the pain came back. And then they went to Wisconsin and had a number of treatments, and then the pain came back. So at this point, I said, uh, why do you want to do CalMare therapy if the pain keeps coming back? Which, because the CalMare doesn't cure anything. It'll give people relief for a while. You can't gauge on how long they're going to have relief from. But therapies that I also use, and one is called on-demand therapy, along with neurogenics, they can be used for, and the synexis can be used for like CRPS and chronic regional pain syndrome. So I don't know. They decided they were going to think about it and say what they wanted to do if they want to continue with CalMare therapy or something different. But I had a gentleman come in and he had pain that started last year, unsuspectingly in his chest. And he's been all over the place, and nobody can figure out, nobody can give him relief with any medication. So he was wondering about CalMare, and I said, well, your pain on the right side of your chest, and they don't know what causes it, and they decide it's rib pain. Blah, blah. He's been to a chiropractor, nothing. So I use a therapy we have in the office called on-demand therapy, and I started him off with Mike. I also do microcurrent, frequency specific microcurrent, which is it's amazing. He didn't really see a difference in the frequency specific just after 2 treatments. So I said, you know what? Normally I don't jump ship that fast, but let's try on-demand. Well, we did on-demand therapy, and he called me last night because I had just seen him 2 days ago, and he said, "I can't believe the difference." He said, I was able to sleep, and he says, "I wasn't when I would turn, I wouldn't get that pain." He goes, "It's not gone, but it's the first improvement I've seen since last year." So there are a number of things that outside of CalMare, and CalMare is very good. But here's the thing: a lot of these people that go for CalMare therapy, they don't know about these other therapies that can help. They see, oh, nerve scrambler, so then they go to get the scrambler therapy. Now, if somebody comes to the office and said they're getting good results from CalMare therapy, I'm going to continue with it. No question,
Yeah.
I'm going to continue with it.
So can you explain the difference between CalMare therapy and on-demand? I mean, I'm familiar with CalMare, but some of my audience might not be. And then on-demand, I don't understand how it works myself.
Okay, all right, so CalMare therapy basically is a nerve scrambler, and it blocks the pain signals, so the body perceives no pain. So it just shuts it off, and the brain interprets these pain signals as no pain signals. And generally, a patient needs about 10 treatments, could need more, but you usually do about 10 treatments in a row. And each treatment will build on the next, where they feel less and uh, less pain. And then, they may need to come back for a redo. Most do. They'll have to come back, and at some point, it could be months before they come back, but eventually they'll have to come back for a redo. The on-demand therapy is totally different. The on-demand therapy was developed in Germany by Dr. Rolf Bindner over 30 years ago, and it uses very specific frequencies again. And these are applicators that are placed on the body using specific frequencies for specific types of conditions, anywhere from viral, bacterial, asthma, any type of condition. And what it uses very specific frequencies to increase the energy of the organ or nerve or tissue. And so that's how it works. It's cleared by the FDA, but it's mentioned as a biofeedback unit.
Yeah, I've been puzzled by that because it's not what I think of as biofeedback. I'm a biofeedback practitioner, and the
Right,
patient has input into
right,
biofeedback therapy, where on-demand is passive for the patient.
right.
Does it do some analysis too?
No, no, it doesn't. Well, the analysis is subjective because the way it works is there's an applicator used, and you're dialing through different frequencies. You're checking the patient's pulse, and their pulse is going to change. You will see a difference in the pulse rate as soon as you hit that frequency. Then this is the frequency we're going to be using. Now, they are doing, I'm on their group. They're doing a study in Europe with OnDemand to relabel it as a medical device, not so much, a biofeedback device.
So, um, how how do you put all this together for a patient? I'm also, do you throw in nutrition in there? Because
Oh,
nutrition
yes.
seems to be
Yeah.
relevant to healing of any kind.
It's absolutely necessary to, I mean, I have to look at a patient's diet. We do use supplementation. I don't, being a certified nutritionist here in New York, I don't overload patients with supplements. I think supplements, uh, as well as they can help, they can also cause problems if you're taking too much of one thing and not enough of the other. And I find that I test people for their supplements, and I find that, I've had people come in with 30 bottles of supplements that they're taking, that many. I said, that's a waste of money, and I tell patients, look, if you want to do a maintenance, this is what I would suggest taking as a maintenance for supplements, maybe 5 or 6 things. So other than that, you can clean your diet up, clean your diet up. Now,
Mhm.
again, some people have specific conditions where they may need an extra different supplement. You follow me? And that's okay. But people aren't walking out of here with 9, 10, 11, 12 different supplements. No,
Mhm.
I'm interested in fixing the problem. And so that's what I do with neurological integration and some other work that I do.
Mhm.
I've been in practice 40 years. I've been doing training in outside therapeutics since 1989 when this doctor cured me of an allergy I had, and I got interested in that. And that's one of the other things I do is I help people with allergies. So, but as far as the neuropathy goes, when a patient comes in, mainly I decide which therapy I'm going to go with, uh, and that's how it's deemed. Sometimes I
So
feel somebody.
you don't throw a whole bunch of therapies at once at people.
No,
You pick
no.
them,
I'll start with
you
I'll yeah,
evaluate them and then decide which one might be most appropriate.
exactly. We also used infrared therapy. Now, what I mean by that is uh, we use a piece of equipment that looks at the circulation, so we can tell if they're getting enough circulation in their legs and their feet. That way, when we retest them, if they've gone through therapy, we can show them the improvement with regards to circulation coming back into the legs and the feet with neuropathy.
So these therapies that you've been talking about, the main effect of them is to increase circulation or increase
Yes,
healing, or they
yes,
go
increased
together, kind of,
circulation.
right?
Yes, increased circulation, increased nerve repair. Now, I will say it's not enough for them to be in the office. So we only see them twice a week. So what happens the other 5 days? People need therapy to do at home, because it's just not going to happen if you think that well, I'm just going to leave it all to the doctor coming in here. No, doesn't work like that. So what we do is we have a home care kit, and we do have people who purchase the home care kit because they're such a distance away that I can't afford to come in. You're 4 hours away. I can't get here twice a week. Now, right now, we do have a neuropathy patient coming in from Syracuse. Now, where Syracuse is in relation to Buffalo. That's a good 3 hour ride, 2.5, 3 hour ride, and he comes in twice a week. So what we do is in a home care kit, we give them a microcurrent device to use at home, which was developed by a medical doctor for neuropathy. We give them a high frequency nerve plate, and we give them red light therapy, which is probably one of the strongest red light therapy units on the market. It's not something you can pick up at Amazon or anything like that. So that, in conjunction with, we use a specific cream for neuropathy, which contains L-arginine, which increases blood flow. We give them a certain B vitamin complex, and we also give them well, there's something else I can't think off the top of my head. But anyways, and then we of course we give them the diet to follow. So it's
Yeah,
very comprehensive.
that's a pretty amazing program. And when you compare it to what people get if they go to a typical MD, which is a prescription for gabapentin, or
Yeah.
maybe Cymbalta or opioids or all three. Um,
Hmm.
that's not going to fix anything. That's going to give them all sorts of, unpleasant side effects or
Yep.
maybe even dangerous ones.
Hmm.
So that's pretty amazing. And would you say and how long would you say you're treating people for?
What do you mean? Like, for
How
example,
many weeks or
oh,
months?
we no, we go, it's a 3 month program. So we set them up for 24 sessions here in the office. And then when they're done, they can sign up for like a maintenance program if they want, or and they have to continue with the home care devices because when they purchase a program, those devices are theirs to keep. And just like exercises, you do that every day. And it's probably going to take I tell them, a year and a half to reach maximum medical improvement, the best you're going to be. But you want to, medically, they'll say there's no cure for neuropathy. And I tell patients the same thing. I said, you know what? I'm not here to say there's a cure for neuropathy. What we want to do is we want to stop it. We want to stop the progression and improve what you've already got. Now, I tell who would like to see a 60 to 90% improvement in your symptoms? Well, most people would.
Yeah.
I think
So
everybody
that's what people can get is a 60 to 90% improvement.
that's what we shoot for. Absolutely.
Now, you mentioned in the beginning that you got interested in this because of your own neuropathy. How's your
Hmm.
neuropathy?
I would say after 20 years, I'd probably be in a wheelchair if I wasn't doing anything. For sure, for sure. It's doing quite well. Well, my neuropathy is actually caused by I was a hockey goalie in college and high school and played in bar leagues for many. I played for 50 years, and I suffered a severe injury a couple of years ago playing hockey goalie, where some 250-pound guy landed on top of me, bent me over backwards, and ended up with 3 herniated discs. And uh, when I had an MRI, they said this is the cause of your neuropathy. You have complete stenosis that's killing your L5S1 nerve root down to your foot, down to your feet. And he said the only way you're going to relieve that is surgery. And I go, no, I'm not having surgery. So they said the best thing for you to do is just keep doing the therapies you're doing.
Hmm.
So that was finally finding out the cause of that. But I do have a book, Cindy. This is called Getting Your Life Back from Neuropathy. I don't know if you can see that.
Yes, yes.
Let me see if because I've got something blocking my camera here. There it is. Okay. So in this book, and it's available on Amazon. I wrote this book a couple of years ago, explains all the therapies that I do and then some that you can do for neuropathy. So,
Would be great. Getting your life back from neuropathy. So it
mhm.
is available on Amazon, so
Yes.
people can easily find that. Um, so that sounds great. Anything else you'd like to add that you think people might want to know? I know people will ask, is this covered by insurance? I'm pretty sure I know the answer, but
And it begins with an N.
yeah, I mean, unfortunately, insurance will pay for, medication and all sorts of, non-effective treatments for years and spend way more on patients than your program costs. But that's the way it is for everything that the insurance does,
Right.
unfortunately. I
You
think
know,
that, a program like yours, if people can get to you and if they can swing it, it's
right.
well worth their while. So tell people how to get in touch with you.
Well, you can go to my website at Meet Dr. Z. That's MEETDRZ.com. And you'll see all the different therapies that I offer on the website and testimonials. And our phone number is 716-689-3629.
Great, great. And we can maybe put an end card on the video that will have your contact information too.
And the one thing I want to mention, Cindy, I always tell people when you're looking at sickness and people come into the office, I treat infants to seniors, and I have a large Amish practice also. And I tell people it's like a triangle. I call it the triune of health. All right. The bottom part is physical, one side is mental, emotional, the other one is spiritual. The spiritual actually represents the body's overall energy. And that's 90% of the problem. That's not physical. That's 1%. Mental emotion is 9%. when the body starts losing its energy, its overall vital force energy, it starts getting sick. And it affects the mental, emotional, it'll affect the physical. So, and I'm a firm believer again too that a lot of illnesses are emotionally related. No question about it. No
Mhm.
question about it.
So
So, and
you
that
have a therapy that addresses that too?
yes, we do. We have a therapy. We use what's called psychoenergetics, which was developed by Dr. Burness, and it uses very specific homeopathic remedies. But also, I also do neurofeedback. And neurofeedback, well, let me back up. I was doing it up until COVID. And when COVID hit, it kind of wiped it out. People weren't coming in anymore because I was doing seminars. And I'm just starting to get back into doing neurofeedback. The neurofeedback that I'm going to be doing in the office encompasses a very specific helmet. And what I know you're familiar with neurofeedback, right? So the thing with neurofeedback is, you'd put the cap on, you inject the gel, and it's just kind of messy and everything. Well, this company, iSync, has developed. It comes from Japan. Has developed a helmet that has the diodes in there, the red light diodes, and does an amazing brain analysis. So you don't have to use gel or anything like this, and to put ear clips on. And the uh, the exam gets uploaded and a report is sent. It's an amazing report. And then the helmet also treats. So in other words, the helmet can also, the many diodes that are in there will treat the very specific areas of the brain. I also use a therapy called V-Light, VIELIGHT, which is amazing. So that's what I'm looking to get back into the neurofeedback because it really helps a lot of people. Kind of a one-stop shop for everything here.
Yeah, you are. You're pretty amazing. I really like providers like you that have a lot of tools so that, everybody isn't treated the same. It's individualized depending on what you see that people need, whether it's,
Hmm.
physical, emotional, whether it's, nutritional, which,
Right,
very important for some people. So that
you,
sounds great. So, it's meetdrz.com
right.
and say the phone number again.
It's 716-689-3629. We don't charge for consultations. They're free consultations. You come in, and then if we decide to set up for an evaluation, that's separate. And then what I'll do is I'll put a game plan together based on the evaluation. And again, there's many other therapies that we use in the office that I haven't even mentioned. So it's like you only don't have so much time. But when people come in, we talk about the various other therapies. We have what's called biocharger. We also have what's called time waiver therapy. So it's pretty interesting.
Yeah. So when people come in, you just figure out which is best for them and you set up a
Exactly.
program that lasts about
Exactly.
3 months and they have home use devices that they can use. And it's pretty targeted to neuropathy if that's what people are dealing with. So that
Right.
sounds great. Well,
Yep.
thank you so much for your time today.
Oh, you're welcome,
And
Cindy.
I'm I think many people will be contacting you because you do such great work. So
I
thanks so
appreciate it.
much.
Thank you.